Victory Studios in downtown Little Rock, this is Capitol View.
And good Sunday morning to you. Welcome into Capitol View. I'm Jay Bir. The Omicron variant has thrown Arkansas into a COVID mess. So let's just get right to things. Joining us now to talk about some of the recent issues is UAMS Chancellor Dr. Patterson. And Dr. Cam, we appreciate the time. I guess personally, how are you?
I'm doing well. I'm concerned about my team members here at UAMS, how hard they're working, but we're doing okay.
Let's just kind of get to it here. In general here, I mean, you're seeing the numbers this past week. This thing has just exploded. Is this also a thing, just from seeing other countries, other regions having dealt with this a little bit before what Arkansas has, is this sort of, has this been anticipated?
We're seeing what has transpired across the other parts of the world that have experienced Omicron before we have here in Arkansas. It's been an explosion in comparison to the previous waves, which were more surges. The good news is the patients who are getting sick are not as sick usually as they were with Delta. With Delta, we have between 25 and 50% of our patients in the ICU. Now it's about 10%. So that's the good news. The bad news is this is the most transmissible respiratory virus any of us have ever experienced. And the number of people who are getting infected and therefore are able to infect other people is just beyond our ability to keep track of.
And I guess as of right now, obviously we know this is an evolving thing here, but what do we know now about the Omicron variant? You kind of mentioned folks aren't as sick as maybe what we saw with the Delta version here. So, I mean, is this one of these deals where a lot of people are it's more transmissible, but it's not as serious? This seems to be kind of the frame of mind with this one. But what do we know so far?
Well, yeah, it's more transmissible, but it's less serious. But keep in mind that if it's half as deadly, but 5 times as many people get infected, the number of deaths is still greater. And we are seeing some of that right now. Here's what we know, Jay. We know that this is much more transmissible than any of the other variants that we've experienced. That's number one. Number two, as you said, it is less likely to land you in the ICU. Number three, it is somewhat able to overcome a 2-dose vaccination, but with the booster, you get effective reduction, very effective reduction in hospitalization and a substantial reduction in symptoms if you get exposed to COVID-19. The last thing that we know is that the Omicron variant is resistant to many, but not all, of the monoclonal antibody therapies that are available. And so if you're thinking that you have a backup plan because you weren't vaccinated, that backup plan is currently non-operative.
And obviously, you guys are having, some of the issues not only with staffing, but just that inundation of testing numbers, things of that nature. Is this something that, just in your discussion with other health leaders in the state, is everybody kind of seeing the same thing, or is it more of, sort of this urban-rural type of setup because everybody thinks, oh, I should come to, the bigger cities to be able to get through and get a little quicker with things?
Well, sometimes it's easier to see things in the bigger cities. We have had with the previous surges the experience that the new strain lands in an urban area and then it takes a while for it to get into rural areas. That time frame has gotten shorter. And I think it's partly because the virus has adapted, but partly it's so transmissible. It just doesn't take that long to get from Little Rock to McGee.
And two, what are you guys doing to sort of prep for the potential for hospitalization numbers? Because in the past we've seen, you see these surges come up, and then about a week, week and a half, maybe 2 weeks later, the hospitalizations tend to follow. Seeing the numbers where they are, you guys have got to be kind of on pins and needles right now.
We are on pins and needles, and I'm concerned about what happens over the past week. Fortunately, for the past 3 or 4 days, we've been hovering right around 48 to 53 patients admitted to the hospital with complications of COVID-19. That's under normal circumstances, that's manageable. It's a stress right now because we've got 621 of our employees who are at home or quarantined because of exposure or infection with COVID-19. That's almost 10% of our clinical workforce. That's creating a difficult situation to manage, not just for COVID-19 patients, but for everybody who's admitted to the hospital.
That kind of leads me into what I wanted to really touch on next here is just the nursing status here. And I know even this past week, the travel nurse industry was kind of brought up at the Capitol because it is kind of putting a little pressure on the hospital system here as a whole. In fact, I spoke with one nurse briefly, and she kind of even said, you know, this could very well bankrupt smaller hospitals. I mean, are we to that point yet where, you know, it's financial dire straits here, or kind of, you know, how do we manage kind of that travel nurse because of the rate of pay is so much greater for them and the demand is also there?
This is a big issue, and Representative Bentley and others talked about this down at the Capitol last week. It's a big problem, and if you just look at UAMS, over the calendar year 2021, we had almost 1,000 nurses leave UAMS, which is extraordinary. The vast majority of them taking traveling nursing jobs, which then means we have to turn around and go into the traveling nurse market, which we avoid doing. Our travel nurse spend last year was about $15 million. Now, that's tough for us to cover. If you've got a rural hospital where you're struggling with reimbursement, struggling with other issues, having to go into the traveling nurse market and doubling the price that you have to pay for nursing services, yeah, that's crippling. And if this situation continues, and keep in mind, this is not dependent on Omicron. This is just dependent on the general circumstances that we're in. If this continues, this is going to be a strain that a lot of hospitals in our state are not going to be able to withstand. And
I guess, too, I guess the next question begs to ask is there a way to compete with it right now? I mean, it's hard, I know, to even get to double, but are there any incentives, or is this sort of a thing that's just in constant communication, kind of thinking outside the box as best you can?
It's partly that. You know, we're looking at patient care technicians and other nursing extenders who can help nurses do more work, but asking nurses to do more work is, I think, not sustainable and really not fair to them. That's not what they came here to do. You know, over the long term, we need to figure out how we can train more nurses, but that's going to take time. So there's not an easy fix for this. It is going to be a challenge, and frankly, you know, if COVID-19 went away tomorrow, the traveling nurse situation would persist for at least a couple of years.
Wow. Well, we're all hoping that COVID-19 will go away tomorrow, that's for sure here. But as of right now, it's definitely on the rise here in the state of Arkansas. Dr. Cam Patterson, boss, we certainly do appreciate some of the insights. Best of luck out there on the front lines, and we'll do it again soon.
Thanks so much, Jay. Appreciate you.
You bet. Well, coming up after a quick break, a Democrat is finally in the fold for the race in Congressional District 1. Monte Hodges joins us to talk about his decision to run. You're watching Capitol View on Sunday morning.
Watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back into Capitol View. Well, we finally have a Democrat over in the District 1 congressional race, and he is so kind to join us here this morning. In fact, he's even braving the elements, so that just shows how good he is on this show, and he makes it work. Representative Monte Hodges, maybe we can add U.S. representative in due time, but boss, how you doing?
I'm fantastic, thank you, Jay. How are you?
I'm hanging in there. I guess, you know, first things first here. You know, you're going for the big seat there in Congress. I guess, why Congress, and why would you think now is a good time to kind of try to make this run?
You know, I just felt like it was time. I feel personally, being in the 1st Congressional District, that I've been unrepresented, and our voices have been unheard in the 1st Congressional District. So I felt there was a need to step up to that plate and be a true voice for the 1st Congressional District.
Now,
in this Delta corridor.
Go ahead, yeah.
Yeah, in this Delta corridor, you know, we have unique needs, and you know, I'm born and raised a Delta boy, Mississippi County Delta boy, and I know those needs, and I'm ready to step up to the challenge to meet those needs and be the voice for the 1st Congressional District.
And before I kind of cut you off there, I know one of the big needs over there, one of the more publicized ones, at least from this past year, infrastructure. Everybody kind of points to that I-40 bridge as kind of a prime example of that. What do you want to try to do at the congressional level when it does come to infrastructure, and especially over there on the eastern part of the state?
Absolutely. First of all, I'm going to vote for an infrastructure bill that helps bring dollars to our state to help with those endeavors. And infrastructure covers so much. Broadband, we hear broadband every session. We hear it all the time ringing around the state how important it is for us to have good broadband in these rural pockets of the state so that we can get ahead of the curve and be competitive like these other large metropolitan areas. And, of course, our highways and bridges and things of that nature, water systems, and all those things play a big role in that. So most definitely would be a champion when it comes to infrastructure issues. I have two big, huge steel mills in my district. There's a lot of trucks, a lot of tonnage of steel that comes in and out, and we have to make sure we have strong, safe highways for these people to travel upon. And as a matter of fact, North 55 in particular, is probably one of the most traveled stretch of interstates in the state of Arkansas. And so there's definitely a need for infrastructure dollars, and we have to be on top of that.
Now I know everybody kind of equates, broadband, things of that nature with economic growth. They kind of tend to go hand in hand here. And you kind of mentioned here locally that broadband has been a buzzword for really a few years now. I guess on top of what all is currently going on when it comes to broadband, what do you want to try to add on to that? Because there are some dollars flowing in when it does come to broadband, and it seems that that's been really kicked into high gear. But what do you want to add to it? How do you want to make that more accessible to the folks?
Absolutely. Broadband covers a broad area. Not only does it education, of course, with COVID going on, our students are at home doing virtual. We have to ensure they have proper access to the internet and things of that nature. Our medical environment, our medical society, ambulance have tablets in them. That could be a life or death situation trying to get to a location and you don't have proper access to your tablet that's in your ambulance. Someone may have a heart attack. And so time matters. All those things play a part, even agriculture. These big combines and tractors are sophisticated nowadays. And our farmers need to have access to broadband to operate efficiently and effectively with the equipment that they have. So broadband stretches so over a lot.
You're a banker by trade. There's already one banker from the state of Arkansas representing in Congressional District 3 here at French Hill. I guess, what do you want to try to add to that? What do you want to bring from that banking background to the national level? Obviously, a lot of people would automatically point to, balancing the budget, having that amendment in there, kind of similar to what Arkansas does. But what do you want to try to bring when it comes to that banking background to the party here?
A lot of our smaller banks, a lot of our community banks have had to carry the weight of things that have transpired because of bad banking, and so banks have been overregulated, and that's cumbersome and it's costly to these banks that didn't play a role in the debacle that took place in our country years ago. And so most definitely we try to relieve some of these cumbersome regulation that we put on banks nowadays, so that they can flow freely and their bottom line won't be so affected.
Now, I know it's the early stages of the website, but one of the things you've got out there as part of your platform is sort of reform when it comes to sentencing guidelines and creating a pathway for inmates to transition back out into society. What do you really want to kind of key in on when it comes to some of those sentencing guidelines?
First of all, the punishment should fit the crime. As a matter of fact, I was just on the phone before we got on with an inmate in one of our facilities that called me on some work that he's trying to do for clemency and all. And so the punishment should fit the crime. In the last session, I proposed some legislation that passed bipartisan to reduce some of these felony charges to misdemeanors. The punishment should fit the crime. We're giving these young men and women felony charges. It's putting a dark cloud over their head. They're having issues finding jobs, finding housing, and also we need to make sure that we're trying to shut down on that revolving door and recidivism, even when they get out as well, making sure that they have job placement and career training and things of that nature, so that they won't reoffend and they succeed once they get out.
I know it's early in the campaigning for you here. You just announced this past week here, but do you have a campaign song picked out necessarily yet? Because I know you've got the headshots. You're real good with that. If you follow the guy on Twitter, boy, my guy Monte here, he's looking fresh to death all the time. But do you have a song to kind of fit that sort of swagger that you want to bring to the party here?
You know what? I have not picked out a theme song as of yet, but I'm sure one will pop up sooner or later. Yeah.
I'll drop you my my Apple iTunes playlist for you. Maybe you can pick something out of there.
Send me your song list so I can see which one I want to.
I got you covered there. U.S. congressional candidate for the Democratic Party, Monte Hodges. Boss, we certainly do appreciate the time. Thank you for bracing the weather, and we will definitely do it again.
Absolutely. Thank you. Have a great day.
All right. And when we come back, the riot on the U.S. Capitol a year ago this past week. We take you to D.C. on how it was remembered from a couple of different perspectives. You're watching Capitol View on Sunday morning.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back into Capitol View. President Joe Biden accused former President Donald Trump and his supporters of holding a, quote, dagger at the throat of democracy as he marked the anniversary of the attack on the U.S. Capitol. The president's remarks launched the start of a day-long remembrance on Capitol Hill. Our Washington correspondent Jesse Tenor has more on how the nation's top leaders are remembering the events from that day.
He can't accept he lost.
President Joe Biden's voice filled Statuary Hall at the U.S. Capitol, where 1 year ago, supporters of former President Donald Trump attacked police, broke windows, and carried the Confederate flag.
For the first time in our history, a president had not just lost an election, he tried to prevent the peaceful transfer of power as a violent mob breached the Capitol.
The president forcefully blamed his predecessor for the attack and pushed back on his claims about the election results.
You can't love your country only when you win.
Vice President Kamala Harris was still a senator at the time and stressed it wasn't clear then how the attack would end.
How close we came to an election overturned. That reflects the fragility of democracy.
Harris and her colleagues ultimately returned to the Capitol later that night to certify the election results, which House Speaker Nancy Pelosi, one of the rioters' main targets, said proved their efforts failed.
The Congress, because of the courage of all of you, rose to honor our oath and protect our democracy.
Republicans largely kept a low profile Thursday, with many of them in Georgia for the funeral of their former colleague, Senator Johnny Isakson. This week, Trump canceled his own January 6th event, but released a statement reviving his attack on President Biden and the Democratic Party, accusing them of rigging the election.
Now, following President Biden's speech to mark the day, two Republican lawmakers also shared a very different take on that day. Our Washington correspondent Rashad Hudson with this one.
Republican Representatives Matt Gaetz of Florida and Marjorie Taylor Greene of Georgia say they want to expose the truth about January 6th.
January 6th last year wasn't an insurrection. No one has been charged with insurrection.
A year ago, Gaetz and Greene joined fellow Republican lawmakers in trying to overturn the 2020 presidential election by blocking the certification of the results.
Joe Biden's certification still occurred on January 6th, but we were deprived of the opportunity to make our argument to the country about election integrity.
Greene says since that day, Trump supporters have been unfairly targeted and thrown in jail.
This is a two-tiered justice system that should never exist in our country.
She says the Justice Department should use the same energy to arrest rioters from protests in the summer of 2020.
If Democrats cared about riots, they would have cared about the Antifa BLM riots all over the country.
Gaetz and Greene are some of the only Republicans speaking publicly on the anniversary after former President Trump canceled a press conference. Illinois Congressman Sean Casten says Gates and Green are siding with the rioters and not upholding their constitutional duty.
And they are using their platform to inspire hatred. They're an embarrassment on our country.
So far, the Justice Department has arrested more than 700 people in connection to the events of January 6. Reporting in Washington, Rashad Hudson.
The Arkansas Department of Health will no longer conduct contact tracing for adults starting on January 18th. Dr. Jennifer Delahaye with the Department of Health said it just wasn't practical for the companies that do contact tracing for the state to try to hire the amount of people needed to do tracing. She said by the time they get those people in place, this surge could very well be on the downslope. So instead, they're shifting their focus to school-aged kids to identify those contacts in an effort to keep schools open.
Most vulnerable groups is going to be those children who cannot yet be vaccinated, as well as those who haven't had the opportunity to become fully vaccinated.
Dr. Delahaye said ADH will reevaluate their contact tracing policy in the future. One of the most effective treatments against COVID is now in short supply. Arkansas' supply of monoclonal antibodies has hit a low, with hospitals such as UAMS and Baptist Health running out of all but a few vials. Hospital officials say the last few shipments are saved for those with the most severe or at-risk cases, and most COVID sufferers won't be able to receive treatment. One of the latest antibody receipts at UAMS says she's concerned over the lack of treatment options in the middle of a spike.
It's very alarming to me that others can't benefit from the same sort of treatment, considering the huge rise in new cases that we're seeing right now.
Governor Hutchinson first mentioned the decreasing supply in his weekly press briefing last Thursday. He has asked the federal government to allocate more doses for the natural state, but it's not clear when any additional shipments will arrive or the number of treatments. And we are back to wrap it up after this. You're watching Capitol View on Sunday morning.
Morning talk focused on the political scene in Arkansas.
And you see it here. No more papers, no more show. That is it for this week's version of Capitol View. I want to thank my guests, Representative Monte Hodges, also Dr. Cam Patterson. I also want to thank my most important guest, and that is you, the viewer here. Make sure you're right back here again next week for an all-new Capitol View. Enjoy the rest of your Sunday.